And today we're talking about food labels and chronic kidney disease. I'm giving you 7 nutrients to watch out for. When you have chronic kidney disease, or CKD, it is of the utmost importance that you eat the proper nutrition. When you eat properly, you can actually slow down your progression of kidney disease, and you can delay or even prevent having to go on dialysis, depending on the cause of your disease. Also, when you have CKD, you filter out substances and electrolytes less efficiently. And so you really have to be careful, because if you eat certain foods in excess, you can build up too many of certain electrolytes in your body, and it can cause your heart to go into an abnormal rhythm or even to stop. So yes, when you have chronic kidney disease, proper nutrition is literally a matter of life or death. So let's talk about it. Let's talk about food labels and chronic kidney disease. 1, sodium or salt. Eating salt in excess can worsen your chronic kidney disease. When you have too much salt in your diet, it can worsen high blood pressure, which is the second leading cause of patients going on dialysis or needing a transplant. Also, if you eat salt in excess and you have CKD, it can cause you to retain fluid. And if you retain too much fluid, it can lead to a buildup of fluid in the lungs or pulmonary edema, which can cause you to have breathing problems or even respiratory failure. It is recommended that most patients with CKD have less than 2 grams or 2,000 milligrams of sodium each day, but not less than 1,500 milligrams. Some organizations like the American Heart Association have even stricter recommendations and recommend less than 1.5 grams of sodium per day or 1,500 milligrams of sodium. Be sure to consult with your physician. In order to avoid excess sodium, you want to be a label watcher. You want to read those food labels. You will see the salt listed as sodium. And so you want to look at the milligrams or mg and make sure when you go throughout your day, you try to stay under that 2,000 milligrams or even 1,500 milligrams. And remember, even in foods around the house or in foods that you cook, there may be salt added. And so you want to be cognizant of that. Avoiding fried foods, chips, prepackaged foods are ways to help to reduce your sodium intake. Be sure to watch my video on 10 low sodium foods to eat when you have high blood pressure after you finish watching this video. Number 2, phosphorus. Phosphorus is a nutrient that can actually be good for your bones. It can help you to maintain healthy and strong bones. But when you have CKD, you tend to excrete phosphorus less. You don't get rid of the phosphorus the way that you should, and you develop hyperphosphatemia, or elevated phosphorus in the blood. Now, when this happens, you can also develop an elevated PTH, or parathyroid hormone, which can lead to weak bones and increase your risk for bone fractures. Elevated phosphorus can also cause issues with cardiovascular disease, and it can create a really uncomfortable, itchy skin when you have high phosphorus. People with CKD or chronic kidney disease who have an eGFR of less than 60 and estimated glomerular filtration rate of less than 60 should limit the phosphorus to anywhere from 800 milligrams to 1,000 milligrams per day. Be sure to consult with your physician and your renal dietitian to be sure what phosphorus level is right for you. How can you limit your phosphorus? Read the food labels. When you get your food, you want to look and see how many milligrams of phosphorus it contains. And again, if you have CKD, you want to make sure you keep it 800 to 1,000 milligrams if you have CKD3. And if you have more advanced kidney disease, you may need to limit your phosphorus to less than 800 milligrams. Now, if your CKD is very advanced, like if you have CKD stage 4 or CKD stage 5, then you may actually need phos binders. And these are medicines that you take at the same time that you eat that will actually bind to the phosphorus and keep it from being elevated in your blood. Foods to avoid if you're trying to limit your phosphorus intake include milk, cheese, chocolate, ice cream. I know, everything in moderation, but you definitely want to be a label watcher in order to watch out for phosphorus in your diet if you have chronic kidney disease. Number 3, potassium. You definitely have to watch out for potassium if you have CKD. Potassium is an electrolyte that's really good in that it helps you to have normal heartbeats. It can also help you with muscle contraction and relaxation. However, when you have CKD, especially advanced CKD, you don't filter out the potassium the way that you should, and you can get excess levels in your blood. When this happens, when you get high levels of potassium in your blood, then it can lead to abnormal heartbeats or arrhythmias. It can even cause your heart to stop. And so it's very important to be aware of your level of CKD and to know how much potassium you should have in your diet. Be sure to watch my video on CKD stages explained after you finish watching this video. So for most people who do not have CKD, potassium intake can range anywhere from 2 to 5 grams per day. It is recommended that most adults have 4.7 grams of potassium per day. If you have CKD, however, you want to limit your potassium intake. Certainly, if you have progressed to CKD stage 3 or beyond, you want to limit that potassium intake to about 2 grams per day. Again, consult with your nephrologist and your renal dietitian to find out what level of potassium is right for you. Because even if you don't have a very advanced level of CKD, if you're on certain medications that may increase the potassium in your blood, like ACE inhibitors, ARBs, spironolactone, then you may also need to limit your potassium. The best way to watch out for potassium is to read those food labels. Again, look and see how many milligrams of potassium are in your serving of food. And make sure you look at the serving size, because a lot of times these serving sizes are smaller than what you think they should be. So multiply it out. If you're eating a whole pack of something and it says that it has 4 servings in it, and you look at the potassium and it says, oh, it only has 200 milligrams per serving. If you've eaten the whole package, make sure you multiply that out by 4 so you know just how much potassium you're taking in. So yes, read the labels for potassium. You also want to avoid certain foods that have high potassium if you have CKD. Foods like bananas, tomatoes, oranges, avocados, spinach, kiwi, nectarines. Yeah, I know those sound good. Again, everything in moderation. Consult with your physician. But if you have CKD, potassium is a nutrient you need to watch out for. Number 4, protein. You definitely want to watch your protein intake if you have chronic kidney disease, because if you have excess protein with kidney disease, it can hasten the progression of your kidney disease. It can lead you to dialysis faster. Also, if you have a protein intake that is too high, then it can cause you to have an increased acid load. It can make your blood more acidic or have a low pH. You know how you can see alkaline water being sold at grocery stores, or people are talking about how being alkaline is more healthy? Well, yes, if you eat excess protein and you have CKD, your body can be the opposite of alkaline and you can be acidic, which is not healthy for you. When you have excess protein with CKD, you can also increase the toxins or the poisons in your body. You can make that BUN number on your lab, blood urea nitrogen, too high. So how much protein should you have? Generally, if your eGFR is less than 30, you should start restricting your protein to 0.6 to 0.8 grams per kilogram of your body weight. So that usually averages about 60 to 80 grams of protein per day for most people. Consult with your physician. In order to watch out for the protein, again, you need to read labels. When you eat something, look at the label, look at how many milligrams or how many grams of protein it has, and try to make sure that you stay within that 60 to 80 grams per day if you have CKD and if your doctor has instructed you to do so. Now, if you have nephrotic syndrome, or if you're someone who is spilling an excessive amount of protein, then your protein restriction may be different. Also, if you've already progressed to end-stage renal disease and you're on dialysis, you also may have a different protein restriction. In other words, you may need to actually eat more protein. But in general, for patients who have CKD, who are not on dialysis and who do not have nephrotic syndrome, you want to restrict that protein to 0.6 to 0.8 grams per kilograms of body weight. Now, I told you how to read the labels. But what if you're eating things like meat, like fish, like salmon? How are you supposed to know how much protein? Well, the average piece of salmon, if you think about an ounce of salmon, it has about 6 grams of protein per ounce. So if you're having a nice little fillet of a 6-ounce piece of salmon, that's 36 grams of protein. And if you're eating some chicken, some white meat chicken with no skin, if you're eating a serving that's about the size of the palm of my hand, that's going to be about 4 ounces. And 4 ounces of chicken is about 35 grams of protein.